Welcome to the online training module. The purpose of this training is to get a better understanding of emotional behavior disorders. When we look at emotional behavior disorders, we first need to know what the definition is. IDEA defines it as follows: an inability to learn that cannot be explained by intellectual, sensory, or health factors, an inability to build or maintain satisfactory interpersonal relationships with peers and teachers, inappropriate types of behavior or feelings under normal circumstances, a general pervasive mood of unhappiness or depression, a tendency to develop physical symptoms or fears associated with personal or school problems. Emotional disturbances can affect an individual in areas beyond the emotional side. Depending on the specific mental disorder, a person's physical, social, or cognitive skills may also be affected. Mental illnesses are medical conditions that disrupt a person's thinking, feeling, mood, ability to relate to others, and daily functioning. Mental illnesses are medical conditions that often result in a diminished capacity for coping with the ordinary demands of life. Children with the most serious emotional disturbances may exhibit distorted thinking, excessive anxiety, bizarre motor acts, and abnormal mood swings. Many children who do not have emotional disturbance may display some of these same behaviors at various times during their development. However, when children have an emotional disturbance, these behaviors continue over a long period of time. Their behavior signals that they are not coping with their environment or with the people around them. Some of the characteristics and behaviors seen in children who have an emotional disturbance include hyperactivity, including a short attention span or impulsiveness, aggression, or behavior like acting out or fighting, withdrawal, not interacting socially with others, excessive fear or anxiety, immaturity involving inappropriate crying, temper tantrums, poor coping skills, and learning difficulties. Students with EBD are impacted in both academic and behavior. Students tend to fall in the low average range when compared to peers without disabilities. Students tend to function at least one or more grade levels below. Students exhibit academic delays regardless of their instructional setting. And finally, social skill deficits are common with students with EBD and experience deficits that lead to inappropriate peer and adult interactions and social withdrawal. The Behavior Intervention Plan targets 1 to 3 of a student's undesirable behaviors with interventions that are linked to the functions of the behavior. Each intervention specifically addresses a measurable, clearly stated target behavior. A BIP can include prevention strategies, which stops the behavior before it begins, as well as replacement behaviors, which achieve the same function as the disruptive behavior without causing disruption. The environment is considered, and the functional behavior assessment and BIP team may determine that a change in a student's schedule or in the arrangement of their classroom is called for. In addition, the BIP provides a plan for responding to the old behavior that is being replaced and promoting the new behavior.